confidence in your relationships to more opportunity in your career, a wider smile changes everything. Celebrities know the power of a great smile, and they use it to their advantage, so why can't you? Here to show us how easy it is to have a wider, more captivating smile is the Tooth Lady, Texas Tooth Lady, Dr. Terry Alani. Hello there. So when it comes to the color of the teeth, people make judgments about folks just by the color of their teeth. And it really does impact a lot of people's image or their self-esteem.
No, it does. And especially with all the social media, everybody's having apps to filter out, you know, the flaws. So a white smile really is important. And the best person to go to when you want to discuss whitening your teeth is the dental office. You can waste a lot of money buying all these over-the-counter products, because you really need to know what the cause of the discoloration is.
Absolutely. What kinds of things can actually impact the color of our teeth, besides the things we hear like, you know, wine and coffee and stuff
right,
like that?
Exactly. And some people have tetracycline staining. Some people, as we age, our teeth just get yellower. So it really depends on your age and also just other factors, you know, such as, you know, coffee, cigarette smoking, things like that.
Yeah.
And basically, if you're going to gauge, it's the white teeth, it's usually the white of your eyes.
Yeah, you know, and that's a good point.
Your teeth will get as white as the white of your eyes.
And they're like too white for them, or the colors, I mean, right? It's just like, it's just off.
Yeah, the best balance is...
Did you get your teeth whitened?
Yeah, but you look at and everybody whitens out differently, which is really interesting.
Right. So make it look more natural, like you just have the colored teeth. Okay, is there any reason not to whiten your teeth?
Okay, people that have real short teeth and have a gummy smile, they might not want to whiten as much because it'll make the gummy smile look a lot more apparent. So you want to be careful with that. Also, if you have root recession, that will not whiten, but you can whiten your teeth. We just cover that when we do the in-office whitening.
Yeah, which is, again, the point of in the office.
And also, if a patient has veneers, or say just one veneer, one crown, or composite fillings, people don't realize that does not whiten. That's why it's so important to see us, the professional, to discuss that with you, because then you're going to have white teeth, and then the veneer is going to stay the same color.
Yeah, make it consistent.
Exactly. And then the other thing is, if you do have a crown that you had done, say, 10 years ago, it will stay the same color, and your rest of your teeth will be yellow. You can always whiten up to where that crown color is. People aren't aware of that, but you need to have that supervised by a dentist.
Yeah, okay. So can some of the whitening techniques not be safe? And I think some of them that are out there, I always wonder about not being in a dentist's office where you can gauge and use professional products.
Well, the problem is I call it bleachorexia. Yeah. It's when you over-bleach your teeth. Anything in moderation is good. Whitening is very, very safe. And the ingredients are carbamide peroxide and hydrogen peroxide. And so it's very, very safe. Now, if you have sensitivity, what we tell our patients is 2 weeks before you're going to whiten your teeth, you can get Prevident, which you get at your dental office, or Sensodyne. Prevident has potassium nitrate in it. It will help desensitize your teeth, so when you do whiten, they won't be as sensitive. Also, we have different strengths now for whitening that you can get in your office in the little gels.
Okay, with that different strength, can you use that like on if one tooth is acting up? Because I always have one tooth that wants to act up.
You could just, if you're using,
to match it better.
If you're using the trays, you could just put it in that one tooth to get it to come to the color of the rest of your teeth. Yes.
Okay, so there's a combination of methods that you can use. We've heard a lot about Zoom.
The most effective, they've done lots of studies, the most effective is the in-office Zoom whitening with a combination of trays up to 2 weeks after.
Okay.
In our office with the Zoom whitening, we actually give you the trays, so you don't have to purchase those separately, and you wear those 2 weeks after.
Yeah, big difference there.
If you have tetracycline staining, a lot of people come in and they go, I can't get these white. Well, there's a reason. It's very resistant to stain. Yellow teeth whiten the best. Tetracycline stain and gray stain are the most difficult. So with the tetracycline staining, what you do is you wear trays long term. I'm talking up to 4 to 6 months.
Okay, and how long
every day.
Okay, and then
for
how
like
long
an
does
hour.
your whitening last? If you
about
for
6 months to 2 years, depending. Of course, you want to drink your coffee out of a straw and avoid tobacco and red wine.
And your wine out of a straw.
Exactly, exactly.
All right. Before we go, this is kind of cool. People always do types of things for their teeth. We know there's the gold teeth, there's the cutouts in the gold, there's all that type of stuff.
Right.
But now we have, tell them what these are.
Okay, so my business partner, Debbie Poxamon, and I have created a company called Rockstas. They are removable tooth stickers. And we are now marketing to dentists, So instead of leaving your dentist with a sticker on your shirt, you now can have a sticker on your smile. And you can actually have something to smile about. It's great for selfies. Our patients are loving them, and now they're available at our website at rockstas.com.
Yes. Okay, now it's supposed to dry your teeth.
You've got to, here's the Kleenex. You've got to dry your teeth.
All right, hold on a second.
Because they have to be on a dry surface. They last up to about 4 hours, and our patients are loving them.
It says awesome.
Yeah.
Upside down. Do I have awesome upside down?
Awesome. No, you've got it up too high. So basically, and they are, we've had them safety tested, and they last about up to 4 hours, and they're just amazing. Our patients are loving them.
All right. We'll have one that says Texans on it or something. All right.